This is Alice. She's been my patient for several years, but in June, beginning of June, had a nasty fall and injured her right knee. My opinion, you had to have different opinions. It was when you first injure a knee like this, it's terrible. It was a tear of the meniscus, and what should I do? Well, doctor wants me to have surgery, and I goes, well, why don't you wait? Let's keep you balanced, give you laser therapy, pulse electromagnetic frequency therapy. Take care of yourself at home. Think positive thoughts. Let the body heal itself. Well, you know, it's 50-50 proposition, but if you can stand the pain, wait and see what happens. This is a star athlete, decathlon lady, and the last thing she would want would be knee surgery. So that was June. July, August, September, October, she went to the orthopedic surgeon. He says, you know what, you're doing pretty good. And correct me if I'm wrong, let's not do surgery. It looks like you're healing up. This is November. Are you back working out?
Oh, yeah. I've increased weight.
And training again for the decathlon?
Yeah.
Okay. And singing on YouTube for Ring of Fire.
Yes.
So all you Ring of Fire people, you better listen to her now. All right. So this is one of those cases where you stress conservatism. Whether it's the shoulder or the knee or the hip, understand something. The body innately heals itself. Don't be jumping real quick to go get something cut on. Don't be jumping like, oh, give me all those Vicodin and Percocets and Oxycontins. There's other natural ways to take care of these things, and your body will heal. Give it a chance. So she's here for her treatment today. She has various areas that are just kind of sore, because when you throw a knee out like that, it disrupts her whole posture, okay? So please face down, Alice. You'd never believe she was 70, would you? Don't believe that. All right, let's see. We got a little, what I see here is a right knee that doesn't want to extend all the way. Her calcaneus is posterior, but see right here, was this the injured knee?
Yes.
Yeah, it doesn't want to quite go into full extension. Acceptable, but gradually. See, it used to be like it wouldn't go down past here. And that was 6 months ago. July, August, September, October, 4 months ago. Now it's all the way down. It's doing pretty good, working out, exercising. So again, left leg is short, right leg is long. She's hitting. When you have a long leg, remember you hit harder on the high side, which can affect knees and ankles. On the shorter side, you're using the hip sacroiliac more. You have more problems up in here. But nevertheless, dorsiflexion, good. Achilles tendon sticks out in the navicular bone. Because of the knee, it's affected her gait. Gait, not G-A-T-E, gait, G-A-I-T, is how you walk. So because of the knee, she limped around and was trying to protect her knee with her foot. So she'd hold her foot at different places when she'd walk to take pressure off of her knee. Because of that, she developed functional problems with her foot. So if her knee gets well and it's perfect, if you overlook the foot, you got a foot problem, eventually will affect the knee again. Because remember, all the balance starts at the floor with the feet up. If you want to know more about the importance of feet and the pedal foundation, go to foot levelers. Get on your computer and punch in foot levelers, FOOTLEVELERS.com. A very wise man, friend of mine, Dr. Monty Greenewald, started this company probably 50 years ago. And I met him when I was in chiropractic school, and he had this belief that everything starts from the feet and it goes up. And if you don't fix the feet, why give an adjustment? Because it's just going to go out of alignment again. Assuming you're a human being and you walk on ground with two legs. That's a lot of us. And he's right.
Can we cut right there for just 1 second, Don? Can you just wipe your face? You got sweat all over you.
Yeah. It was fine here until you got in this room. Ready? Come on, drop your foot. So we'll do what we did before. That's one of my standard adjustments. Rarely, I have 1,000 patients, maybe 10 of them won't need a foot adjustment. Okay, again, we'll check the leg lengths. And, well, an improvement. Still a little long, but we took away about 70% of it. Go up to the pelvis, anterior pelvis, posterior pelvis. We get a block. Down on the pelvis on that side. Left side was posterior. We push it anterior. We come to the tailbone, tap it over, get the ischium bone, tap it down, check the rest of the spine. Ah, she's doing very good. Okay, fixation right here at C5. Vertebral fixation. Right there. Tender. Yeah, so somehow, you know, you get aches. If you work out as hard as Alice works out, and even if you don't, you wake up and you have these pains and these aches, and like, where did this come from? Well, they usually go away if they don't. Okay, you wait a day or so, and if they don't, like, you see your doctor. If it's an emergency, you see your medical doctor. Excruciating pain, you go to the emergency room. But if it's something neuromusculoskeletal, okay, go to your chiropractor. Someone who knows what he's doing. He'll fix it conservatively without you being on drugs, without you getting surgery. It's the only way to go. Unless you just like to get cut on. Ugh. Okay. Oh. This was the bad knee. When she came in, she had this much flexion. Now, that's 2 of them you've seen today. Now, 4 inches, 2 inches. So she's about 90% corrected in her knee. It's only been 5 months. She's going to be fine. Lay on your side over here and face me, please. What I'm going to do is a lumbar adjustment. This area here, I lay her on her side. Relax, please. Come on. Come on. Tap the 5th lumbar vertebra in. I use my elbow to adjust the pelvis. If chiropractors are watching this, you young guys are watching this, or young ladies that are chiropractors, be careful how you give adjustments, because I'm all beat up with wrist injuries and hand injury and elbow and neck. Try to get it close to your body and use your elbows, okay? And try not to let your head bounce every time you do an adjustment because you hurt your neck. Sorry, Alice. Relax. Come on, come on, come on. Thank you. On your back. Bend this knee. Yeah. She's restricted in internal rotation. You knew that, didn't you?
I know that.
Yeah. And so, hit the pubic bone, and it opens up. Now, I don't know if you realize that. Okay, this is important. This is a secret I'm revealing for the first time. It was here. I adjusted the pubic bone here. I more than doubled the rotation in her hip. Why do you need rotation in your hip? When you run, your hip rolls over. You need your hips to roll. All you running coaches know that. All you athletes know that. If you don't have the right range of motion in your hip, you can't run. And if you do, you can't run with power, or you can't cut right and left. So you got to have balance. Bend your knee. Yeah. Well, she's been working out hard because she has a restriction in both. There we go. So Alice was restricted in both internal rotation in the right hip and the left hip. What that means to me is the pelvis, whole pelvis shifted. Okay, when the pelvis shifts, like so, here's your hip bones here. So if her pelvis shifts, the hip bones come back. Then they don't rotate. So she has, when both of them are like this, internal rotation restriction, you got to look at L5S1, the sacrum, as being compressed a little bit. So you want to open the sacrum up a little. Okay, both hands, please. Thank you. Your shoulders are good, right?
Yes.
So we do a little L5 decompression. You lift up the arms, the torso lifts, and very often gives you an audible release at the 5th lumbar. You knew that, though, didn't you? All right. Again, occiput, a little bit out, not bad, but again, posterior on the right, anterior on the left, goes along with the short leg syndrome. Turn your head to the right, please. So we give a little tap. Come on. Come on. Little tap at C1. The other way. Come on. Little tap at C2. You know, there's been a lot of discussion about, oh, chiropractors, they'll hurt your neck. They do this, they do that. A properly done adjustment, which is about what 99% of the chiropractors perform, and if they don't, then you need to tell them, if it's your chiropractor, okay, doesn't need to do an aggressive adjustment. It's a slight turn of the neck, no more than 45 degrees. It puts no pressure on any of the arteries, nothing. You really can't be hurt. May I have? Thank you. Lift up your head for me. And we'll just do this mid-back. Thank you. Very nice. One more. That's it. That's called an anteriority adjustment. The vertebra and the ribs flared a little bit and the vertebra dipped in. So to bring the vertebra back, you flex the spine and do the adjustment or the manipulation, which pops the vertebra back out or loosens it up. Please sit up, Alice. Swing your feet this way. Check your clavicles, even. Second ribs. You know, you got a little tightness here, but
It's pretty good.
yeah, it's awful good. Let me a little bit of a right rib tap. Head into the right lateral flex position. Tap it. You don't have to hit it. You use chiropractors, use your leg. Tap it. It goes right into place. Bucket handle. Remember, it's a bucket handle. Excellent. A little A to P shoulder movement. Yeah, a little ear adjustment. Oh, you love that, don't you?
Yeah.
Okay, why is he doing that ear adjustment? What's that doctor doing that for? Eustachian tube, middle ear, inner ear, tentorium cerebelli. The ears are connected, the base of the brain stem. So when I do this, it separates, it opens up. It just like gives you like a refreshing little, brain adjustment, ear adjustment. I can hear better, the ringing went away. Cool. We'll check your elbows.
And my hands.
And your hands. Women are looser and more double jointed than men. Yes, that's true. Now your elbows are good. Wrists. Okay, you line up the ulna and the head of the radius, distal head of the radius. It's a little bit off here. Just that. Get the thumb. Okay, it goes click, click, clunk, and all the bones go in place. Let's check this one. Not as bad as this one. Do that one a little bit differently. Just the wrists. Now, can she go pitch that curveball?
And chase my husband around.
Chase her husband around and grab him now. Okay, very good. Thank you, Alice.
Thank you.
Bless you. Thanks, everybody.